Well, today is Doctor's Day. What is that, you ask? Well, let me tell you, it's a day to set aside to honor the hard work of physicians as they take on the challenge of their career's work, which is to keep all of us healthy.
And it's also an opportunity to talk about the load that doctors carry, the heavy load, which is leading to high rates of burnout nationwide. Community Health Network has been working to address burnout through its Center for Physician Well-Being. And here to tell us all about it is Dr. Noah Kersey, Community Health Chief Wellness Officer. Thank you so much for being here.
Yeah, thanks for having me. I appreciate it.
So you saw this really as a looming problem nearly a decade ago. This predates the pandemic even.
It does, yeah. We've had emerging evidence for more than a decade now that physician burnout is really epidemic, and it's been getting worse over time. And fortunately, we had at Community Health Network, some of our senior physician leaders went to one of the first American conferences on physician health, and they learned about some of that research and how it impacts not only the physicians, but our patients. And they took the initiative to develop the center in 2017, well before the pandemic.
And what are the key factors that lead to burnout, and then what are the consequences of it?
Yeah, so it is multifactorial. There are a lot of things that contributed to it, but I think it really boils down to physicians went into medicine because they really want to take care of patients. And nowadays, medicine is a lot different than it used to be. There are a lot of competing factors, pressures that take away from our ability just to sit and talk with patients and help them. We've got, paperwork that we got to do, charting, patient portal messages have become a thing. So lots of things that distract from the care of medicine. And the consequences of it for physicians, there's higher rates of substance use, depression, mental health issues, suicide. But for patients as well, we know that physicians make more mistakes. There's lower patient quality care and lower patient satisfaction when physicians are burned out.
So what does this look like tangibly? What does this center look like? What is the program to help doctor well-being?
Yeah, so it's a small group. There's 5 of us total, 2 physicians, 2 advanced practice providers, and we've got a manager over the center. And basically, we really focus on how do we improve the culture at our health network at Community, and how do we improve some of the workplace efficiency, some of those administrative burdens. So we participate in a lot of different projects. We try to help implement AI initiatives, use technology to reduce some of that administrative burden, but we also train our physician leaders to help make sure that they have some wellness-centered leadership skills, and really that goes a long way at reducing the burnout.
I can imagine as a health system, you want to recruit and you want to retain the highest level healthcare providers. And when there is burnout, which leads to turnover, that costs time and money.
It does, absolutely. Yeah, we know from the American Medical Association, it costs about $500,000 to $1 million to replace a physician. So it makes a lot of sense to keep people well so that you don't have those turnover costs. So it's not only good for the network, but good for physicians themselves and for patients.
And this is personal for you. You were telling us that this is something that you have dealt with earlier in your career.
Absolutely. During residency, I struggled with burnout towards the end, and it took me a year to recover from that. And so having lived through it myself is really what inspired me to become the Chief Wellness Officer and help other physicians to try to avoid that path.
Yeah, and the culture change for the medical community is really essential, don't you think? Because it's like you've got the more senior doctors saying, well, that's what I did. That's where I slept at the hospital. I took all those calls. Now it's your turn.
Absolutely.
And at some point, someone has to stop in and say, enough. Let's do it the right way.
Absolutely. Yeah, that is a big factor. I mean, medical training, that is a big piece of it. So fortunately, the culture is starting to shift. I think the training is improving, and the way that we look at our physicians has shifted over time. We're starting to see some of the reducing stigma around it, just because we have the evidence now that shows the impacts of physician burnout and the fact that it is a problem.
And as you were saying, this is about you, about physicians, about the staff, but at the end of the day, it's also about patient safety and patient care.
Absolutely, and that's the most important thing. At Community, we say patients first, and taking care of our physicians is part of that. You can't put patients first if the physicians are drowning.
Yeah.
Got to put your oxygen mask on before you can help anybody else.
Absolutely.
That's right. Well, and thanks so much to you for creating an environment where doctors feel like they can safely say, I'm not doing well. I need help, without the consequences being perhaps the loss of their career.
Yeah, that's been a very important thing. We've got resources for physicians that are free and confidential for coaching, counseling, all of that, so that it's really easy to access those things and ask for help when you need it.
All right, Dr. Noah Kersey, thank you so much for all that you do, and we hope to see you again next time.
Thank you very much. Appreciate it.